Hello. Today we are going to be talking about a serious complication of diabetes. It's called diabetic peripheral neuropathy. Patients typically report feeling tingling, numbness, burning, electrical shooting pain type sensations when this occurs. The main player is glucose. Now, insulin acts as a doorman to allow the glucose to enter the cells from the bloodstream. There are certain cells of our body that do not require insulin for the glucose to enter the cell, such as our nerve tissue, our nerve cells, also our kidney cells, and cells of our eyes, specifically being our retina. So, since these cells do not have a doorman, when there are elevated blood sugars, there's too much glucose in the bloodstream, and specifically the cells of the nerve will take in that glucose whether it needs it for energy or not. When that glucose is not converted into energy, it then is converted into an alternate molecule, meaning it's metabolized differently. So glucose is then converted into sorbitol. Sorbitol then accumulates inside the cell and acts like a sponge. It absorbs in just a ton of water, and that cell will become swollen, and if that cell becomes significantly swollen, it will be damaged. So this is how elevated blood sugars are very damaging to our nerves. Things that we want to focus in on are keeping those blood sugars down with diet and exercise. Vitamin B6 will actually inhibit the sorbitol pathway, so sorbitol does not accumulate inside the cells. A medication that I like to prescribe my patients is called Metnex, and that medication contains vitamin B12 and vitamin B6. B12 is needed to regenerate any damaged nerve cells, and the B6 again prevents that sorbitol from forming. Now, there are other medications that your doctor can prescribe, like anti-epileptic drugs, which is Lyrica, gabapentin, and also tricyclic antidepressants. But the main thing that we want to focus in on is keeping those blood sugar levels down with diet and exercise.